We're gonna go ahead and transfer you off the stretcher. Just give us 2 seconds.
1, 2, 3.
There we go. Alrighty, Joe. I'm Christina. I'm gonna be one of your nurses today. I'm gonna go ahead and get the report from the PACU. Nurse, I'll be right back.
Hi, Joe. My name is Ife. I'll be getting your vital signs today.
This is patient Joseph Meter.
Okay.
He is 4 hours post-op from an open appendectomy.
Mm-hmm.
A laparoscopic approach was attempted, but there was too much inflammation, so the surgeon decided to open.
Okay. I'm back. I'm just here. Can you please just verify your name for me one more time?
Joe.
Okay, thank you so much. And do you know where you are, Joe?
Yeah, in the hospital, right?
Yes, that is correct.
These students are taking care of a patient who has just returned from the operating room. They're using the knowledge and skills they've learned in the classroom and in the hospital to apply to this high-fidelity simulation. Simulation allows our students to stretch their thinking and practice their clinical judgment in an immersive, safe, controlled, and realistic practice environment. High-fidelity mannequins, such as this one, have real physiologic responses, such as palpable pulses, lung sounds, heart sounds, bowel sounds, and reactive pupils.
Do you have any allergies to any medications or anything at all?
Yeah, I'm allergic to sulfa drugs.
Okay.
And he gets hives when he gets sulfa.
And you get hives when you have sulfa?
Yeah, I get really bad hives.
Okay.
The mannequin is being controlled from behind a two-way mirror by a simulation operations specialist and a faculty member. They respond in real time to the student's actions to replicate a real clinical scenario. We work towards a place where they're actually evaluated here. In some simulation centers, it's purely not graded, but we move in this program towards it being higher stakes. They actually may have to repeat an experience if they didn't hit a certain metric or a certain goal. We also employ standardized or simulated patients. These trained actors portray the role of patients, interdisciplinary team members, or even a family member. Standardized patients allow students to practice the psychosocial aspects of care, with the priorities being reflection, learning, and evaluation.
How are you feeling right now after the simulation and the case itself?
I personally really liked the case. My main takeaway from today's simulation would have to be patient safety. First, especially when we were transferring, and then also maintaining patient dignity.
Okay.
For me, it will be acknowledging the patient's complaints right away. The patient did complain he was feeling nauseous, so it's very important to acknowledge that so that we show that we're not ignoring the patient and we're giving them patient-centered care rather than just going in and just doing what we already had planned.
Many hospitals today are organized by specialty units, such as orthopedics or cardiac surgery. While this is great for patient care, it limits student experience in clinical rotations. For example, a student who is assigned to a neurology floor may see a lot of seizures and strokes, but they may never get to care for a patient having a GI bleed or heart attack. By using simulation, we are working to ensure that every Rutgers nursing graduate is prepared as a nurse generalist for real-world clinical practice.